Nutrition is an essential, especially the first 1,000 days from the conception to 2 years. Poor nutrition causes irreversible cognitive and physical damage with consequences for individuals, households, communities, and the nation. According to a Global Nutrition Report 2018, malnutrition is responsible for more ill health than any other cause. Therefore, good health is impossible without good nutrition. According to Charles Asimwe Bamhata, nutrition consultant with the Office of the Prime Minister in Uganda, nutrition must be prioritized to reduce health consequences.
So the stunting has happened. What are the causes? It is an issue of poor dietary intake. So the dietary intake there, what we mean, the number of foods that a person is eating. A child is supposed to eat around 8 food groups: animal protein, plant protein, fruits and vegetables. Then you have the breast milk if the child is 6 to 23 months. Then you have the cereals, the grains. So there are many. But with this, if a child is consuming 5 out of the 8, then we say the child is consuming a dietary diversified food.
Charles was over the weekend named by the Nutrition Society of Uganda as a key nutrition policy champion. He was behind key policy implementations on the nutrition agenda in the country. According to the Cost of Hunger in Africa Uganda report, improved nutrition in Uganda from 2013 to 2015 would save more than 101,000 infant lives by improving breastfeeding practices, 60,000 children's lives by decreasing vitamin A deficiency, 119,000 children's lives by preventing stunting, 26,000 infant lives by reducing low birth weight, and 20,000 infants and 7,000 mothers' lives by decreasing maternal anemia, something Charles Asimwe agrees with pertinently. By 2025, this would total to 19.8 million equivalent school years of learning gained, lead to economic gains through increased productivity exceeding about 4.3 trillion Uganda shillings, equivalent to 1.7 billion US dollars by 2025, and also lead to improvement in the health and family planning sectors. Since health, family planning, and nutrition are synergistic, investing in any one of these sectors alone would not lead to the same return as investing in all of them.
A high population which has food but they are stunted, for example. One of the factors is food insecurity. Now, food insecurity, what do I mean here? You can have availability of food, you have access and utilization. So an example is, let's say in Toro. Toro has food available. People can access it, but the consumption now goes at the home. You might find you have food in the home, but the mother does not have time to prepare the food. So therefore, mere production and availability of food in the country does not translate into the nutrition outcomes. Then another factor we look at is the health services. You can have, let's say, you get an example, a district is supposed to have, every sub-county is supposed to have a center 3, where children can come. They are assessed for nutrition, mothers are given health education, they are given counseling. Then, so when the health centers are not there, or they are there but the health workers are not there, then it will also affect nutrition. Then another issue is water, sanitation and hygiene, availability of water, sanitation and hygiene, hand washing, all of those affect nutrition outcomes. Then issue of education, especially when the population has a limited number of girls who are completing secondary level.